If at all you are not able to understand anything, you can just stop and ask. Do you have joint pain?
No.
Okay. Just feel how it feels and hold this, fix this joint up, down, up, down, up, down. It's easy to do it for others. Right, left, right, left, right, left, right, left. So two more set of exercises called as active exercises if you do it for yourself. This is passive exercise if somebody else does for you. There are benefits of that also. Here I can stretch more. Okay. This is a technique which they use in sports medicine to facilitate those muscles. If somebody is playing tennis or they focus on those set of muscles, increase it by stretch and passive stretch. Rotation. Change the direction. You also keep doing. Third joint. 1, 2, 3, 4, 5. Right and left. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, 5. Imagine I have done this for all the fingers. How do you feel? So next is for the wrist joint. Up and down. Same concept. It's very easy to understand. Those up and down, right and left, clockwise, anti-clockwise. So focus on each joint. Even if you don't know, it's easy. You don't need to know all the joints. So if this range of movements is this much, you feel resistance to your hands. And then do a little stretch, release. Little stretch, release. Then right and left.
I want to remind us something.
Yeah, please.
You mentioned about the movements of the fingers with the mobiles, but it's almost the same movements. The difference is that you're moving, your mind is somewhere and the fingers are somewhere. But when he started, he was telling that there are 5 aspects of your body. If you're in yogic practices, one thing is that you need to synchronize all the 5. So here when you're doing, you're aware of that movement. When you're working on your mobile, you're not aware that you're moving. So you need to always synchronize all the 5 layers of us when you're doing the practice. If you don't synchronize, it just becomes an exercise.
Yes, I was meaning that this was a remedy for
Yes.
what
For
my
those-
hand hurts from, I don't
Mobile,
like texting.
Yes.
My hand hurts.
Okay, that is very good for that.
So we call this range of movements at each joints in a medical terminologies, or Sukshma Vyayama, or loosening exercises for technical terms. It is still not just the muscles we are working on. We are working on the loosening of tendons and ligaments before we really start working on the muscles. Even with this itself, those muscles which are stiff can be loosened. This simple range of movements. Change. Same way, imagine an old lady, 68, 70, 80, not able to do exercises as you do. So for them, can be passive exercise is what I have shown demonstrated, and active exercise means what you do. Passive exercise have one advantage, that you stretch and facilitate. What facilitation? You are facilitating the joint to stretch little more beyond normal. If I can do this, it is active. But in passive I can do some more. So this will help to loosen the tendons and ligaments Tendons and ligament means you agree these are muscles. Muscles cannot go and attach to the bones directly. It needs some hard tissue. So muscles will become small and become a wide structure, and then it goes and get connected. And if you see this, these muscles have wide tendon and it is going and connecting here. So till this I can move. So this is a tendon. Ligament is nothing but something which binds the joints. Something which binds the joints to put it together. If ligaments are not there, it will be like suddenly like a Michael Jackson song. Suddenly it will disappear. No structure of this structure will not be standing. So those are ligaments. It's easy to understand. Okay. Same way for feet. Up and down, right and left, clockwise rotation, anti-clockwise rotation for each fingers, and then ankle and knee and hip joint. We'll do this exercise. Come on. I'll not demonstrate about the toes because it will take time and you already know it. We'll do this for ankles, ankle movement. 3 sets of exercises. One can be done standing if somebody is comfortable. One can be done with support. Third can be done in a sitting position. Up and down, right and left, clockwise, anti-clockwise, clockwise. Same on standing position. And with this, if you wish, you can hold your hands together, so you can connect with each other. Hold your hands so that you can balance also. Up, down, 4, 5, 6, 7, 8, 9, 10. Right and left, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Change the direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wait for a moment. In the right ankle we have done range of movements. In the left thigh there is a isometric contraction of thigh muscles. You are not moving it, but still it is paining. Drop your leg now. Could you grasp? Non-technical, but still easy to understand in a short time. This is a better way. Like this, ankle movement followed by knee joint movement. Catch hold of the back of your knee. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4. Change. 1, 2, 3, 4. Stop. Third set of exercise at the level of hip joint. Raise your leg up. 1, center without touching the ground. 3, left, center. It's one set. 1, left, center, right. Second set. Rotation. 1 and change the direction. 2. Stop. So ankle movement, knee and hip joint. We are doing hip joint and the hip joint we have done only once. We need to do like this. 1, 2, 3, 4, 5. Right and left. 1. Again, notice on other leg which is holding your body weight is also strengthening. That's why you feel that more pain. Rotation. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, and 5. Slowly release. From the practice. Quickly we'll do it on left side 5 counts without stopping at all the 3. So this is one set of exercise. You do it separately. Separately ankle movement, separately knee movement, separately hip joint movement. And this will do all one by one. Or like this. 1, 2, 3, 4, 5. Right and left. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. Knee. 1, 2, 3, 4, 5. Right and left. 1, 2, 3, 4. Rotation. 1, 2, 3, 4, 5. Change. 1, 2, 3, 4, 5. They're dropping the leg down. 1, 2, 3, 4, 5. Right and left. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4, and 5. Change. 1, 2, 3, 4, and 5. Slowly stop the practice. You see something unique happening. In one leg, you are just doing range of movements. In other leg, it is holding your body weight upright. So there is more resistance on the other leg. Other leg, you feel pain. Okay? Sit down for a while. Is it okay? Great to go through. Passive exercises are mainly used in mental field because there is something unique happening called as neuromuscular facilitation or passive stretch. Brain usually gets all the information in the form of stretch, heat, chemicals, pressure, and receptors of the body throughout the body. If your blood pressure is too much high, the baroreceptors or the receptors which will sense the pressure will send the signal to the brain. If your body chemicals has more carbon dioxide or more oxygen, your chemoreceptors, chemical sensing receptors will send signals to the brain. If your muscles are getting stretched too much, there is something called as stretch reflex. If your muscles are contracting, the contraction sends a signal to the brain on the opposite side. If you are contracting these groups of muscles, there is a relaxation of other groups of muscles. So positive stimulus here, simultaneously negative stimulus here. If I want to extend positive stimulus here, negative stimulus to here, I have to extend my hands. Extension muscles will contract and flexion muscles will relax. Easy to go through? These are called as agonist, antagonist. One works in one direction, other works in opposite direction. For both of them to coordinate, when this is working, this has to relax. When this is working, this has to relax. Similarly, in yoga pose, we do one pose of some group of muscles, and to relax those, we do opposite pose and counter pose. It is a similar concept. Okay. One more last word. No need to worry about each word which I speak. It's like a medical jargon, will say, medical syllable or medical super hi-fi words. Don't worry. If you understand the gist or abstract with what sense I am telling at the background, if you understand that, that's more than enough. You are able to grasp that, I think, very well. So one more set of exercises. One group of muscles works towards the gravity. One group of muscles works against the gravity. When I am standing, my front muscles are working towards the gravity. My back muscles are working against the gravity. When this and this balances, then I stand. Okay. You are able to cope up with this information? No? So this is all the grammar content of the therapeutic exercises for the back, neck, knee pain. With this background, if you have little information about asanas, which asanas are working on which groups of muscles. If you have this anatomy, physiology and asana knowledge, you can design your own. If not, range of movements are also simple exercise. Next thing will be resistance exercise. By simply moving the range, I am making the tendons and ligaments loose. making those connective tissues and the joint holding tissues little loose so that my muscles can move easily. But to increase the strength, I use something called as resistance. I wish somebody else, anybody having shoulder pain here?
Yes.
So I will give resistance for range of movement.
I'm not really sure actually.
Okay. That also will work. Will work with both. Just hand like this. I use 2 fingers. One to press. When I hold like this, I'll ask her to press down. So when she is contacting towards the gravity, she feels very comfortable because gravity is with her. Hands can go down easily. When she is coming against, she feels a little difficult. You can observe her. So it depends on your experience to give how much pressure. If it is somebody old person, give little pressure. If somebody is strong, hefty, give more pressure so that these groups of muscles can be strengthened. Press my fingers down, down, completely down. Press, 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 press. Press my fingers up. Okay. Oh, she's strong lady. Down. Because she has been conditioned to do it. Before I had done, I said it, so she's putting more pressure. Good. I'm putting more pressure now. Good, good, good. Can you feel those muscles? Up, 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 up.
I feel my rotator cuff.
Rotator cuff. Rotator cuff means these groups of muscles around the shoulder. So resistance can be used in this way. Hands in front. Expand your hands. I will give you resistance. Expand. You see your muscles. It's good that you are wearing this dress so that you can see the muscles. You can see trapezius. This muscle. No need to remember the names. This muscles. You can just focus inside. Oh. You're able to grasp. I'm teaching something at the same time. You know what exercises need to be done. Alright, do it one more time. You are going to do this, and I am going to give you pressure. Extend without bending at the elbows, without using your leaning. Don't use your leaning of the body weight. Just use your shoulders. Press my fingers out. Good. Good. With the elbow straight. Yeah. Now pull it inside. In. Like this. You are using your body weight. No problem. Do it. Done. Thank you. Could you see? We are using resistance exercises to strengthen shoulders. So it's easy to tell the ask exercises. Okay, this exercise for this exercise for this, but it's difficult to make you understand the concept, and then if you understand the concept, you can design easily. So which one is working for you? The technique which I am showing, or the idea behind the technique? Which one is working for you?
For me,
What you are able to understand?
The idea.
Idea is what? For you? Also.
I do similar exercises, but I use a band,
Yeah.
like a resistance
So I
band.
am giving multiple options. You can use the resistance band also. So it's a permutation combination of different exercises. I am using hand because I want to see which group of muscles I need to focus. If the person is already in tune to know this exercise, once he or she goes and learn from a teacher or a physiotherapist or a sports medicine person, the doctor or physiotherapist will advise you. Okay, for leg exercises, there will be stripe which will put it at the door, close the door, and then do this. Band is resistance band. Okay. Same exercise what we have done, we can use it with resistance.
What I noticed is sometimes when I ask my clients to open up with resistance, say what you did with me, they bring their shoulders up.
Yeah.
So that's very common. So the most people, me too, that example.
Yeah, I'm also hunchback person because I read big books and do like this all the time.
Yes, it's very difficult to let them move in the right direction actually. Do you have an idea I use cues, like imagine something.
So in this what you can use a long stick.
Behind?
Like the Indian cowboys will have a long stick and you'll have a buffalo, tuck, it's a buffalo, you see. You can use that, it can make your shoulders and arm very straight, one line. And around that line, the alignment of shoulders will be totally right. Or there's one more technical issue now. Is this okay? It's too much information, but we'll close it down. That's the easiest possible postural correction technique, which is a combination of physiotherapy, medical knowledge and alignment of the spine and the center of gravity. Very easy. Imagine back of your head, occiput, back of your shoulders, hip and heel. So 1, 2, 3, 4. Should be in normal alignment. My diagrams are not exact, it is like a cartoon, but you should understand. The most easiest possible technique which you can adopt without any medical knowledge. Anatomical position of the body is like this. My body is exactly divided into half by center of gravity and my hands are extended, open palms, and my legs are like this. Or like this also, no problem. Usually like this. Medical people who study like this. Any movement which goes towards center is called as medial. Anything which goes against called as lateral. Anything which comes contracting like this, flexion, extension. Anything again goes towards the center, we say adduction, abduction. Again, no need to worry, it's a simple range of movements. We all stand up. So base of your big toe, base of your little toe, this and heel. You are going to align. The heels touching each other. Big toe, little toe, and heels, base of the heel. You keep imagining those 3 points here. 1, 2, 3. Now try to put your body weight exactly on these 6 points from the both feet. If you feel more pressure at the heels, you put little body movement forward. If you feel more pressure on the base of the big toe and the heel, you also put little pressure of your body weight onto the 5th little toes base of the little toe. With this, come to near to the wall. Touch your heel, hips, back of your shoulders and head to the wall. So notice now shoulder alignment becomes exactly right. You see, shoulder alignment will become correct automatically. So it's an easy way to correct. Rather than somebody standing and you are correcting by yourself. Okay, rest like this, rest like this, rest like this. This way of correction is little tricky and the client will not understand. So this is little easiest possible technique. Okay. So now again imagine those 6 points and try to bring your body's weight onto these 6 points exactly. So this is a perfect postural correction. So with this, we'll walk few steps and be aware of this postural collection. One alignment of back of your head, back of your shoulders, hips and heels in one alignment, and those 6 points being balanced. Be aware of these 6 and just walk a little bit. It looks funny, Zen monks walking meditation.
Zombie walk.
So walking also can be meditation because you are aware. Awareness is a step of meditation where you are aware of your posture, you are aware of those points, you are aware of the alignment of these 4 points. So you can say it as an postural meditation. You want to say something like that? You can do postural correction meditation or something. Is it interesting? Easy? Easy? No?